Hello, everyone. Welcome to the MDEH class. So, we started the class. In previous class, we discussed about in the clinical anatomy subject about frozen shoulder. So, I hope you understood the topic. If any questions or anything related the topic, you can ask me in the group. Okay, I will answer it definitely regarding the topic. Okay, so we are starting new topic today. So every day we will complete one topic. Definitely we will try. So here today we will talk about tennis elbow. Okay. So this class is mix of Hindi and English both. Okay, both student can understand easily, and I am trying to explain the topic in very simple English language so everyone can easily understood. Okay. So in today's class we'll talk about tennis elbow. So our subject is clinical anatomy. Means anatomically any disturbance occur. So the patient is coming with complaint due to anatomical disturbance. So how we diagnose? Okay, we are learning from this subject. So like frozen shoulder. So pain in the shoulder region. So we discussed that there is a issue of ligaments, tendons, maybe nerve issue. But in frozen shoulder, what will happen? The capsule condition is inflamed. Means the inflammation occurs in the capsules. Thus, the reason surrounding tissues also damage. So the patient will come to you uh, clinical signs like pain in the shoulder. You have to examine clinical examination. By that, you will understood, yeah, and you will diagnose that this person is affected with frozen shoulder. Okay, so this is our motto. So every person get diagnosed properly, okay, anatomically, and he can be treated with the help of electrohomeopathy. Okay, so in today's class we will talk about tennis elbow. Tennis elbow, so what are the topics we will cover? So basically anatomy, basic anatomy, not complete anatomy of the thing, and diagnosis and causes of tennis elbow, and what are the symptoms of tennis elbow, clinical examination, how you can examine the patient, okay, and treatment, what are the modern medicine treatment are available for tennis elbow, and what is electrohomeopathy treatment, and some exercises you can advise to the patient to improve the condition. Okay, so an electrohomeopathy treatment. So this is our tennis elbow topics. So I hope you are getting my point. So let's start with elbow anatomy. So basically, if you see this diagram, this is one bone, these are two bones, okay, are joining together. Here it's making a joint is made up of two or more bones. So in elbow we have three bones. One bone is coming from the arm, and two bones are coming from the forearm. Both are gathered together, and arm bone is known as humerus. This is humerus bone. Okay, I hope you understood. This is humerus bone. Here you have two bones. Okay, here radius bones near the thumb. Okay, this is radius bone. This is ulnar bone. This is ulnar bone. Okay, so they are joining there. So and making a elbow joint. In shoulders we have two joints, two bones. In the elbow you have three bones. Okay, you can see in this image also. So this is humerus bone, this is radius bone, this is ulnar bone meeting together, and you have you can able to see this is the synovial membrane, cartilage, everything is available in every joint. Mostly large joints, large type of joints, you will able to see cartilage, number one, ligaments, very important. Ligaments will attach bone to bone, okay, support to bone, and tendon, and you will able to see the nerves, blood vessels, both artery and veins, and lymphatic vessels, lymph vessels. All are you will able to see in some joints, or like shoulder joint, elbow joint, and knee joint. You will able to see bursa also. Okay, and in knee joint you will able to see meniscus. We will discuss and knee clinical anatomy. So here, what will happen that the elbow joint is affected here. This is also called hing type joint. Means it will not rotate like shoulder. Shoulder will rotate like 360 degrees. But here you have only two movements, extension and flexion. Okay. And flexion also you will able to see this much, and extend also this much. You will unable to do more extension. Okay. Because here you will able to see this is the ulnar bone is fixing to the humerus like hing. Okay. Like this. Okay. So this is important about anatomy of elbow joint. So what will happen in tennis elbow? In tennis elbow, due to the excess use of elbow muscles, extension muscles. So we have two types of muscle. More other muscles also there, but here, which is connecting to the topic, we have two types of muscles. One is which muscles are doing extension. Some muscles are doing flexion. So whoever use the extension muscle excess, because extension muscles are attached to the bone, okay, or flexor muscles also attached to the bone with the help of tendon. So when you're doing a lot of extension type of things, like playing tennis, or you're going to ball, okay, or you're writing like this, so using extension, always in extension positions only. So what will happen, the muscle or the tendon or the in and around of the bone, whatever things are there, so their tissues are affected. So now another part of the joint things, yeah, you need have to name, you have to get the name of the bone also, then only you will able to understand. This is humerus bone. So this is one thing, this is one thing. This is called lateral epicondyle. What is called, this is lateral epicondyle. This is called medial epicondyle. Where it situated, I will show you. Okay, so this is medial side. Medial side, this is, so this is the medial side. Okay, this is medial side. You will able to see this is medial side. Here you will able to see this is lateral side. Okay, it is away from the body. So that's the reason we are calling this lateral side. Okay, so this is lateral side, this is medial side. We will call epicondyle. You can touch your area also, you can feel it. Okay, you can feel it. Okay, you can feel it here. Okay, you can feel it. Humerus bone, this is lateral, medial epicondyle. Here you will able to feel it here, lateral epicondyle. So here the extension muscle tendon is fixed. So what will happen? You will get the pain here, exact that, and you will able to see this is the radial bone, ulnar bone. This is trochlea. This is capitulum. This is olecranon. Olecranon. This is olecranon, which is fixing. You can see this is. This is olecranon. Okay, this is olecranon. This is medial condyle. This is lateral condyle. Okay, this is olecranon fixing. Okay, I have one patient that one doctor, fracture happened here. So what happened that he told to the patient, due to the fracture, you are unable to move the joint. So you have to uh, fix like this. Okay. He kept his hand for more than 1 year. So what happened? This bone is what happened due to the immobility. What happened? They developed the tissues around it. So she is unable, or he is unable to do extension. His hand is like this only. Okay, like this, is unable to do anything. Okay, so without knowledge, some people will advise something. So this harmfulness will happen to the patient. Okay, so I hope you understood the anatomy of the how the joint is forming. Okay, and what bones are involved, and what type of joint, what are the things are involved to make elbow joint. Okay, so I am repeating in Hindi also here. So basically यहाँ पे हम टेनिस एल्बो के बारे में बात कर रहे हैं. ये टेनिस एल्बो से पहले हम जानना है कि ये एल्बो जॉइंट कैसे फॉर्म हो रहा है. तो एल्बो एल्बो जॉइंट फॉर्म हो रहा है ह्यूमरस बोन, रेडियस बोन, अल्नार बोन्स के मिलने से. ठीक है. तो जब ये बोन जॉइंट होगा, मिलेगा, तो उसको फिक्स रखने के लिए वहां पर लिगामेंट्स की जरूरत है, वहां पे टेंडन, मसल को जोड़ने के लिए टेंडन की जरूरत है. ठीक है. और मूवमेंट फ्री रहने के लिए बर्सा की जरूरत है. ठीक है. और भी कार्टिलेज की जरूरत है, बहुत सारी चीजों की जरूरत है. ठीक है. देन ओनली उसकी वजह से ही क्या है, मूवमेंट इजीली हो सकता है. और नर्व सप्लाई जरूरत है, ब्लड सप्लाई की जरूरत है, लिम्फेटिक ड्रेनेज, ये सब चीजों की जरूरत है. और कई कई जॉइंट में आपको मिनिस्कस भी देखने को मिलेगा. ठीक है. तो यहाँ पर आप देख सकते हैं, ये बोन है, ये ह्यूमरस बोन है, इसको कहते हैं लैटरल एपिकॉन्डल. ये है मीडियल एपिकॉन्डल. ये रेडियस है, ये अल्ना है, ये कैपिटलम है, ये ट्रोक्लिया है, ये ओलिक्रोनॉन है. जो आप देख सकते हैं हाथ में इधर साइड है जो मीडियल है, इधर से लैटरल है. ये बीच का हिस्सा जो है आपका ओलिक्रोनॉन, जो फिक्स होके, ठीक है, ये जाके फिक्स हुआ हेड ऑफ द ह्यूमरस को. हेड ऑफ द ह्यूमर ये है आपका, समझिए ओलिक्रोनॉन है, हेड ऑफ द ह्यूमर ये ऐसा फिक्स हो गया. तो ये कौन सा है आपका, ये कौन सा है, ये फिक्स हो गया जाके. इसके ऊपर क्या है, यहाँ पर हेड ऑफ द ह्यूमरस है. तो आपका मूवमेंट एक ही सही है, यूनि डायरेक्शन, और बाई डायरेक्शन भी है, मोस्टली यूनि डायरेक्शन. ठीक है. Now, the diagnosis and causes. So, what is the cause, and how you get the term? Is it only called tennis elbow? Mostly in the medical term, you will call as lateral epicondylitis. So, because here the damage occurs of the muscle, ligaments, anything will happen here. Okay. So, that's the reason we will call as lateral epicondylitis. Mostly extension muscles during extension. What are the causes? Due to the muscle strain, you fell down. Okay, so damage happen. Okay, any trauma, any accident leads to damage of those fibers of extension carpi muscle. Okay, or epicondyle. Okay, ligaments, anything in that area, lateral epicondyle, or tendinous degradation. Okay, muscle is okay, but tendon damage happened. Okay, this most happened due to the trauma, accident. Okay, and ligament. Okay, I told you, maybe the damage happened to the ligament, maybe damage to the happened to the tendon, maybe damage happened to the muscle itself, maybe damage happened to the epicondyle itself. Okay, bursa also affected sometimes. Okay, which make bursa, what is the help of bursa, what it will do, it will provide freely movement. Okay, freely movement. Okay, like this, you saw that if the glass, anything is made up of glass, what will they will give, they will provide inner soft, like bubbles like cover. Okay, so what will happen if you throw also, that if you put down or fell down also box. Okay, what will happen? The pressure will not affect the glass. Okay, so like this, the bursa helps for movement, easily movement without tuck tick sound. Okay, so this is the thing happen. So it may be due to this all those things. Sometimes mechanical injury also happen, like in the tennis, in the cricket, or you are doing throw. Okay, arrow throw or anything, you are using your hand extension excessively, so it will damage mechanically. Okay, so you can see this is the area where affected happen, medial epicondyle. What are the symptoms? सो डायग्नोसिस एंड कॉजेस में हम क्या देखने वाले हैं? डायग्नोसिस तो बात करें, कॉजेस क्या है इसके? मोस्टली कॉजेस ये है कि या तो ये कोई एरिया में कोई कोई प्रॉब्लम आए, जैसा कि लिगामेंट्स टियर हो जाए, टेंडन टियर हो जाए, ओके, और या फिर बुरसा वहां पे इफेक्ट हो जाए। ठीक है, ये कब हो सकता है? आप गिरने से हो सकता, मार लगने से हो सकता, या फिर एक्सेस यूटिलाइजेशन ऑफ द जॉइंट, जैसे गेम खेल रहे हैं, टेनिस खेल रहे हैं, या फिर शटल कॉक जो गेम खेलते हैं उसमें हो सकता है सब प्रॉब्लम। ठीक है, तो ऐसे कंडीशन में एक्सेस यूज ऑफ आप एक्सटेंशन एक्सटेंशन को ज्यादा इस्तेमाल करें, तो वहां पे उस एरिया पे ज्यादा इफेक्ट देखने को मिलेगा। ओके, so this is the cause. Now symptoms, what are the symptoms? So your patient will come to your clinic with the pain, localized pain. Here he will have sharp, like anything is you're pricking, severe excess pain. Okay, lateral epicondyle. So if you know the anatomy, then only you will be able to understand. So if a patient come to your clinic, he is telling I have pain here, so you will get confusion. So if you know lateral epicondyle is here, so he using this area access, so there's the reason mechanical injury happened or any trauma happened, anything. Okay, so functional pain also there. So you are when you are getting extension, when in rest also you are getting pain sometime when you are doing any function, then only you will able to have the pain. And sometimes what happen, the pain is less here, but it is radiate, it will go to this muscle. This is extension carpi muscle. Okay, you will get the pain here, muscle mass near. And sometimes what symptoms you will able to see, you will have gripping, less gripping when you are holding this bottle with left hand. Okay, you are getting much more easily, you are able to pick up easily. But when you are taking with right hand, something you are getting forceful energy, you need more energy to hold this bottle. Okay, so means weakness. So some patient will complain pain in rest. Some patient complain when I am moving, I am getting pain here. Some patient complain I don't have pain here, but I have pain here. I have pain here. Some patient complain I didn't have pain, but I have weakness when I hold anything. So this having different symptoms in different patients. So maximum pain is here. Okay, and sometimes it will radiate like this. Okay, sometimes it will radiate like this. सो पेशेंट आपके पास जब आएगा तो सिम्टम्स क्या लेके आएगा? सिम्टम्स देखिए सिंपल है, लोकल पेन होगा, रेस्टिंग में भी पेन होगा यहाँ पर लैटरल एपिकॉन्डाइल में। ठीक है, या फिर आप कुछ चीजों को उठाते वक्त या आप फंक्शन कर रहे हैं, काम कर रहे हैं, उस वक्त पेन होगा। या फिर कुछ पेन यहाँ पे तो नहीं हो रहा, लेकिन पेन क्या हो रहा, रेडिएट हो रहा, आगे हो रहा, ये कह सकता है पेशेंट। या फिर पेशेंट कहेगा सर मुझे वीकनेस आ रही, कोई चीज उठाने से मुझे हाथों में कमजोरी महसूस हो रही। तो दिस विल टेल symptoms to the patient, to the doctor. Okay, now clinical examination. So what we will do, we will do the clinical examination. Okay, so we have different types of epicondylitis. First we have to understand there are lateral epicondylitis, medial epicondylitis, and bursitis. These are different types of elbow pain. Okay, you have to diagnose whether it is lateral epicondyle, medial epicondyle, or bursitis. Okay, so we have examination. We have three types of examination. First is called Cosen's test. Okay, so patient is sitting like this and arms are in rest position, but forearm, you need to tell to the extension first step is extension like this, and you need to tell the pronation. Okay, his fingers are closed, pronation, and tell the patient to give the force here. Okay, to do the extension of the wrist joint. Take a wrist joint, and he will felt pain here while doing extension. This is extension, this is pronation, and this is extension of the wrist joint like this. He will feel the pain here. So this is positive sign of elbow, tennis elbow. Next test is Miller's test. Okay, so what will happen? The patient, you are able to tell the patient to extension, pronation, and do the flexion of the. You are not getting the pressure. Okay, patient will do this. Okay, in the Cozen stance, he will giving the pressure, and you will stabilizing the pressure. Okay, like this. This is Cozen test. Miller's test. This is flexion. Okay, he is doing flexion, and he will feel pain here. This is also positive if the pain is there. Miller's test. And one test is called Maudsley test. Means if you tell the patient this is the extension of elbow joint and this is normal position, not flexion, not extension, you tell the patient to move the this ring finger. Okay, so what will happen while moving the ring finger, he will able to feel the pain here. So this is called Maudsley's test. So this is for confirmation of tennis elbow. सो हाउ यू डू द क्लिनिकल एग्जामिनेशन. सो कैसे आप क्लिनिकल एग्जामिनेशन करेंगे कि ये पेशेंट जो है टेनिस एल्बो का है. आपको एल्बो में जो पेन आएगा उसके रीजन बहुत सारे हो सकते हैं, लेकिन आपको टेनिस एल्बो हो या लैटरल एपिकॉन्डाइलाइटिस ही है, ये कैसे मालूम होगा? ये मालूम होगा एग्जामिनेशन. तो आपको 3 तरीके के टेस्ट करना है. एक टेस्ट का नाम है कोजेंस टेस्ट, मिलर्स टेस्ट और मॉडसेली टेस्ट. कोजेंस टेस्ट में क्या होगा, आप पेशेंट को कहेंगे एक्सटेंशन करिए, प्रोनेट करिए, और आप प्रेशर करिए एक्सटेंशन करने के लिए, और डॉक्टर भी यहाँ पे प्रेशर डालेगा. तो ये प्रेशर के ड्यूरिंग प्रेशर अगर पेन होगा तो ये पॉजिटिव साइन है, पेन नहीं है तो पॉजिटिव साइन नहीं है. तो ये कहलाएगा कोजेंस टेस्ट. दूसरे टेस्ट में सेम एक्सटेंशन, प्रोनेशन, पेशेंट को फ्लेक्जन करने की कहिए, फ्लेक्जन करे तो भी पेन होगा. एक्सटेंशन और फ्लेक्जन दोनों में एक फर्क है. एक्सटेंशन जब करेंगे तो आप भी प्रेशर देंगे, फ्लेक्जन में सिर्फ पेशेंट का प्रेशर रहेगा. और नेक्स्ट है मॉडसिली टेस्ट. इसमें क्या करेंगे, एक्सटेंशन करेंगे और हाथ को इस तरह रखेंगे और पेशेंट को कहेंगे कि आपका रिंग फिंगर आप क्या करिए, इसको मूव करिए, हिलाइए आप. ठीक है, जब इधर हिलाएंगे राइट साइड लेफ्ट साइड, एक्सटेंशन या एडक्शन एबडक्शन करेंगे या रोटेशन करेंगे, जो भी करेंगे, तो उस वक्त आपको यहाँ पे पेन होगा. सो दिस मीन्स द पेशेंट इज सफरिंग फ्रॉम मीडियल, सॉरी मीडियल मीडियल नॉट लैटरल एपिकॉन्डाइलाइटिस. तो ये पेशेंट सफर हो रहा है टेनिस एल्बोस. ओके, सो दिस इज हाउ वी डायग्नोस. इस तरह हम डायग्नोस करेंगे टेनिस एल्बो. अब ट्रीटमेंट, ट्रीटमेंट में देखिए इसके फेसेस. ठीक है, अकॉर्डिंग टू मॉडर्न medicine. So first phase, what is the first phase? Acute pain relief and inflammation control. This is the first line treatment, phase 1. Second, physical therapy, rehabilitation. Second, third, advanced non-surgical intervention. These are in modern medicine only. Okay, we will talk about in electrohomeopathy order. Surgical intervention, it is not cured. Okay, they have four steps or 4 phases. Okay, so what will happen? Acute pain relief or inflammation control. What will they will do? They will advise to take rest. Okay, so whatever things are triggering the pain, you have should avoid. Okay, these are the first thing. You can also advise the patient. Electrohomeopathy doctors also advise the patient whatever things are triggering this pain, you should avoid this. First thing. Next is cryotherapy, means applying ice. Okay, applying ice. Here you can do cold compression to reduce the pain, to reduce the inflammation, because due to the inflammation there is a pain, na? So you can apply cold compression by adding electrohomeopathy remedies. If the patient have right side, take positive remedy. The patient have left side, take negative remedy. I will tell you what remedies are will take. Okay. Next, they will advise painkillers also and advise bracing. So the patient, to reduce the effect on the elbow joint, you will able to take the bracing like this. There is a brace you will get in sports shop. Okay. You advise the patient to uh, put the brace, elbow brace. You will get that. Okay. So it will reduce the force while extension. Some sort of pressure will affect on the brace. Okay, not on the elbow joint. So this is first phase, first line of treatment. Okay, you can also advise the without not give painkillers to him. Okay, it is not our duty. It is not our treatment. Okay, it is the part of modern medicine. Okay, so you can add, some doctors advise topical apply of painkillers. Okay, like ibuprofen, naproxen, diclofenac gel. Most of the persons apply, and they will come to your clinic also. Okay, but it's short term relief. There is no improvement in long term. Okay, physical therapy, rehabilitation. Physical therapy, what you have the exercises, stretching exercises, and workspace, and you are taking fully uh, personal. You are avoiding tennis playing, and you are avoiding what are the large things I am doing. There's a reason this problem is came. Okay, so you should we will avoid that. Okay, completely. And stretching exercises and some small sort of exercises which will strengthen that area, that is advisable. Okay, and in third phase in the modern medicine, they will do non-surgical intervention. What was those? If the pain is not reduced from 6 to 12 weeks, they will advise PRP injections. Your own blood will be taken, and from that plasma rich solution will be injected here. Okay, and after that they will advise corticosteroid injections. If the treatment is not done properly, the patient will not get relief from that. And shockwave therapy also be done. Okay, and blood injections. So they will follow their protocol to treat the patient. Okay, and next last phase is surgical intervention. So if not treated from 6 to 12 months, completely failed, whatever treatment is given, so they will do the surgery. Okay, they will do the surgery. Sorry. Okay, surgery according to their protocol. So यहाँ पे फेसेस है ट्रीटमेंट करने के, चार फेसेस है, जिसमें पहले में पेन कम करना है, इन्फ्लेमेशन करना है। इसमें क्या करेंगे, रेस्ट कराएंगे पेशेंट को, या आइस अप्लाई कराएंगे डेली, या फिर इलेक्ट्रोहोम्योपैथी में आप कोल्ड कंप्रेशन भी कराएंगे, या टॉपिकली पेन किलर भी अप्लाई करा सकते हैं। ये डॉक्टर के एडवाइस के बेसिस पे है मॉडर्न मेडिसिन का। और ब्रेसिंग लगाएंगे, यहाँ पे ब्रेस मिलेगा जो आपके प्रेशर को रोकेगा लैटरल एपिकॉन्डल तक पहुंचने तक। ओके, नेक्स्ट फिजिकल थेरेपी, एक्सरसाइज कराएंगे या एक्सटेंशन, कुछ ऐसे एक्सरसाइज कराएंगे जो स्ट्रेंथ दे, या स्ट्रेचिंग एक्सरसाइज कराएंगे, या फिर जो आपको रेस्ट है वो कंप्लीट बेड रेस्ट कराएंगे, ताकि आप कुछ भी मूवमेंट ना करें, जल्द से जल्द हील होने की वहाँ पे कोशिश कर सके। कुछ नॉन सर्जरिकल इंटरवेंशन है जैसे पीआरपी, और इंजेक्शन है कॉर्टिकोस्टेरॉइड इंजेक्शन, शॉकवेव थेरेपी या ब्लड इंजेक्शन भी देते हैं। ये उनके प्रोटोकॉल के हिसाब से वो लोग फॉलो करते हैं। ओके, नेक्स्ट है, अगर इससे भी अगर ट्रीटमेंट ना हो पाए तो लास्ट में सर्जिकल इंटरवेंशन किया जाता है। ओके, so this is all about the modern treatment. Now come to the part of electrohomeopathy. So basically, if you understand the main reason of lateral epicondylitis, if it is muscle affected, tendon affected, ligament affected, you will able to take S5. All these are treated with S5. Structural issues. Okay. First, you have to do diagnosis according to electrohomeopathy, pulse, tongue, or iris. Whatever you learn, you can do the diagnosis with that tool. Later, select the organ and treat the organ also. Number one. This is the main goal because reason is here. So there is the reason the patient have this problem. Without this, you cannot treat the problem symptom. Okay, cause is present inside that organ. So you have to treat that organ. How do you know that that organ is affected? By checking the pulse, by checking the tongue, or by checking the iris. This is the first line of treatment because this is differ from patient to patient. If a person liver is weak, you will add S5. If a person's stomach is weak, then you add S1 or S10. If a person doesn't have issue in bone marrow, you will able to A3. Okay, heart issue A3, nervous issue, you will add F1. So patient to patient, the treatment will change definitely if you want to treat the cause, real cause. That is very important in electrohomeopathy. So with that help, you will reach to the organ and you will treat the organ, okay, by means of pulse, tongue, and iris diagnosis. But the basic treatment, if you want to give the relief to the patient, initially you will give that. Then after you will study it and again note out the symptoms, and again you have to do pulse diagnosis. Till that you will manage with its treatment. S5, A3B. So initially start with D5. Later on you will have to give in D4. C5, Ver1. When inflammation is that, you have to select Ver1. Then after convert into the Ven1. Initially here also, when inflammation is there, A3B. Later on, you can change into RE also. Okay, if you change here RE, here you will go through Y. Initially, you will give S5, A3B, C5, Ven1, Ver1, G. And after that, reducing pain, inflammation, recovery, you need C3. C3 is very important for all types of any injury, ligament, tendon, okay, like soft tissue injury. C3 is very, very important. Okay. Here also, this is pain remedy, F1, A3, C5, RE. You will give in D6 rapidly. Okay. C17Y antitoxin remedy, because due to that injury, many of the other soft tissues which are harmed here, okay, you have to need to remove from that area, because after sometimes it will also create some inflammation, some infection like this. Okay, and for in application, you have two remedies. F2, initially start with BE, C5, C5B. This is right side, right elbow pain. Left side F2, C5, G, left side pain. Okay, because left side is positive, right side is negative. Okay, BE, RE also. One time you will apply BE, and next time RE, BE, RE replace that. Okay, to get the proper result. Because if you give one remedy, so what will happen? Body will get that, utilize that. Okay, but you will get less result. So you have to change 1 month, 15 days, BE to RE, GE to Y. So here, one thing you have to again remember, you can make into oil form, liquid form, oil, liquid, okay, and you can make into ointment, okay, everything you can make, okay, according to your uh, according to your, some patient will give oil form, okay, some patient will give in ointment form, some you liquid form, like that different things will apt the patient mentality, but everything is work. Okay, so one thing you have to remember, that initially you have to give cold compression. After applying the remedy, you have to give cold compression initially. After reducing pain, reducing inflammation, then for improvement, okay, for improvement, you have to give hot compression. This is the thing you have to remember. Okay, for the AH treatment, along with you can advise the exercises. I will tell about that. These are the exercises like this wrist motion, like this exercises. Okay. And like you can put your hand like this, and like this, slowly, and some sort of weight gain exercises like this, like after extension, you can do this. Okay. There's a simple exercises you can advise the patient. Okay, like you can give any some gradually increase the weight. One day empty bottle, after second 2 to 3 days after a half bottle, 1 liter bottle, then increase the weight. And you can use the wrist, pronation, extension. These are important. Okay, this is like this extension, some sort of weight. Okay, this is small type of weight. Okay, extension exercise also help to improve a lot because it will improve the stability. सो इलेक्ट्रोहोम्योपैथी का ट्रीटमेंट क्या करेंगे हम लोग? S5A3B है, C5N1 और वर्वन जीन देंगे। इनिशियली वर्वन दीजिए, इन्फ्लेमेशन पेन कम होने के बाद वेन पे आ जाइए रिकवरी के लिए। F1A3C5R ये पेन के लिए है, तो पेशेंट को ये लेते रहना है रैपिड डोज, क्योंकि पेन इसका मेन इंपॉर्टेंट फैक्टर रहता है। C17Y एंटी टॉक्सिक रेमेडी है। फिर एप्लीकेशन के लिए आप ऑइंटमेंट बनाइए, ऑयल बनाइए, या आप लिक्विड बेसिस दीजिए। राइट साइड आप ये देंगे, लेफ्ट साइड ये देंगे, क्योंकि पोलैरिटी बेस्ड ऑन पोलैरिटी, राइट साइड पॉजिटिव देंगे, लेफ्ट साइड नेगेटिव रेमेडीज देंगे। और याद रखना ये है कि इनिशियली आपको कोल्ड कंप्रेशन देना है, फिर पेन कम हो गया, इन्फ्लेमेशन जब कम हो जाए, फिर आपको हॉट कंप्रेशन की तरफ जाना है रिकवरी के लिए। ओके, सो दिस इज वेरी इंपॉर्टेंट। इसके साथ साथ अगर आप पेशेंट को एक्सरसाइजेस बताएंगे तो जल्दी रिकवरी होगी। एक चीज आपको हमेशा रिमेंबर रखना है कि स्ट्रक्चरल इश्यूज विल टेक लॉन्ग ड्यूरेशन। दिस इज द व्हाट वी टेल, ये क्या हकीकत है? This is the thing you have to remember, and you have to counsel to the patient. Okay, like frozen shoulder, tennis elbow, this will take longer duration, 2 months, 3 months, 4 months, some will take 6 months also, based upon his ability. Okay, so अगर डिजेनरेटिव स्टेज में है तो ज़्यादा टाइम लगेगा, एंगर है तो जल्दी रिकवरी होगी। तो ये पेशेंट को आप क्या करना है, आपको उसको बताना है। तो ये था आज का क्लास टेनिस एल्बो। So I hope you understood the topic. So whenever a patient come to your clinic, please follow all these things. Then it is very easy to do. Okay. So thank you. Thank you very much.